It's often called the silent killer. It affects nearly half of all adults in the United States, yet many don't even know they have it. We're talking about high blood pressure or hypertension. But what if you could understand this common condition and take control of one of the biggest risk factors for heart disease and stroke, starting today? In the next few minutes, we'll break down exactly what high blood pressure is, what causes it, and the powerful steps you can take to manage it. So, what exactly is high blood pressure? Imagine your blood vessels are like a garden hose, and your heart is the faucet. Blood pressure is the force of the blood pushing against the walls of those vessels as your heart pumps it around your body. A certain amount of pressure is normal and necessary, but when that pressure is consistently too high, it starts to damage the delicate inner lining of the hose, your arteries. When a doctor measures your blood pressure, you'll hear two numbers like 120/80. The top number is the systolic pressure. This is the pressure in your arteries when your heart beats or contracts. The bottom number is the diastolic pressure. This is the pressure in your arteries when your heart rests between beats. A reading below 120/80 is considered normal. When the numbers start to creep up, doctors classify it in stages. Stage 1 hypertension, for example, is when your top number is between 130 and 139, or your bottom number is between 80 and 89. One of the most common questions people ask is, what causes high blood pressure? The answer is complex, involving a mix of factors you can't change and lifestyle habits you can. Unavoidable risk factors include getting older, as blood vessels naturally stiffen over time, and having a family history of hypertension. But many of the most significant risk factors are within our control. An unhealthy diet, especially one high in sodium or salt, is a major contributor. Lack of regular physical activity, excessive alcohol consumption, chronic stress, and poor sleep can all push your blood pressure into a dangerous range. The reason hypertension is called the silent killer is that it rarely has obvious symptoms. You can feel perfectly fine while inside your body, damage is being done to your heart, brain, kidneys, and even your eyes. That's why diagnosis is simple and so important. It's done with a painless test using an inflatable cuff wrapped around your arm. Because your blood pressure can fluctuate, a diagnosis is usually based on the average of 2 or more readings taken on separate occasions. Your doctor might even suggest you monitor your pressure at home to get a clearer picture of your daily levels. If you're diagnosed with high blood pressure, the good news is that you have immense power to manage it. In fact, how to lower blood pressure is one of the top health questions people search for online. For many, lifestyle changes are the first and most effective line of defense. Your doctor will likely recommend a heart-healthy eating plan like the DASH diet, which emphasizes fruits, vegetables, whole grains, and lean proteins, while limiting salt. Regular physical activity is also key. Aiming for about 150 minutes of moderate intensity exercise, like brisk walking, each week can make a huge difference. If you have excess weight, losing even a small amount, just 5 to 10% of your body weight, can significantly improve your blood pressure. Finally, managing stress, limiting alcohol, and quitting smoking are all powerful steps you can take. But what happens when lifestyle changes alone aren't enough to reach your blood pressure goal? That's when your doctor may prescribe medication. It's important to know that starting medication isn't a sign of failure. It's a powerful tool to protect your heart, brain, and kidneys from long-term damage. There are several types or classes of blood pressure medications, and your doctor will choose the best one for you. Let's look at a few of the most common. First, there are diuretics, often colloquially called water pills. They work by helping your kidneys remove extra sodium and water from your body. With less fluid in your blood vessels, the pressure goes down, kind of like turning down the volume of water flowing through that garden hose. Next, there are 2 very common classes, ACE inhibitors and ARBs or ARBs, angiotensin II receptor blockers. They both work by blocking body chemicals that naturally narrow your blood vessels. By keeping the vessels relaxed and open, blood can flow more easily, lowering the pressure. Another type is calcium channel blockers. These prevent calcium from entering the muscles of your cells of your heart and blood vessels. These prevent calcium from entering the muscle cells of your heart and blood vessels. Since calcium has a tightening effect, blocking it allows your blood vessels to relax and widen. Your doctor might prescribe one of these or a combination, depending on your specific health needs. The takeaway is this: these medications are most effective when they work as a team with your healthy lifestyle choices. They aren't a replacement for a good diet and exercise, but a vital partner in managing your hypertension. High blood pressure is a serious condition, but it is not a life sentence. By understanding what the numbers mean, being aware of the risk factors, and embracing heart-healthy habits, with or without medication, you can protect your body and live a long, healthy life. The single most important step you can take is to know your numbers. Talk to your doctor about your blood pressure at your next visit. It's a simple conversation that could save your life. Join us next time for more common health topics on preventative care and living a healthy lifestyle.